Hello, my name is Paul Freeman. I'm editor of Optometry, Journal of the American Optometric Association. I'd like to share with you a summary of the articles written in the August edition of Optometry. Visual function in patients followed at a Veterans Affairs Polytrauma Network site, an electronic medical record review, is an article written about an observational study describing the polytrauma system of care used by the Veterans Health Administration to guide medical care and rehabilitation of injured military personnel serving in Operation Enduring Freedom and Operation Iraqi Freedom. The take-home message in this issue highlight is the importance for optometrists to be aware of the high rates of self-reported symptoms and visual problems in military personnel returning from deployment in the wars in Iraq and Afghanistan. We have two articles in the clinical care section of our journal. Retinal arterial macroaneurysm causing multi-level retinal hemorrhage is a case report of a 59-year-old hypertensive individual who presents with a sudden onset of painless vision loss in one eye. The importance of this article is to be aware of presenting signs and symptoms associated with retinal macroaneurysms as well as the many differentials and possible treatments. The clinical spectrum between posterior polymorphous dystrophy and iridocorneal endothelial syndromes is a case report of a 39-year-old black woman with a previously diagnosed condition of asymmetric corneal posterior polymorphous dystrophy, PPD, and how after careful review the patient was subsequently diagnosed with Chandler syndrome and iridocorneal endothelial syndrome rather than the original diagnosis of PPD. This case points out the need to understand the clinical features of both conditions for the proper diagnosis and management of a patient who presents with a corneal endothelial condition. In the clinical research section, we have three articles. Concordance of flicker comparison versus side-by-side comparison in glaucoma is an interesting article comparing a technique to create the perception of motion, showing glaucoma's structural changes over time, versus traditional side-by-side photographic comparisons. This unique way to view optic nerve heads is impressive, but as the authors state, more study is needed to determine if flicker comparison is a useful tool in the clinical management of structural glaucoma progression. Clinician versus potential acuity test predictions of visual outcome after cataract surgery is a study to compare the ability of potential vision tests in clinical judgment to predict postoperative visual acuity after uneventful cataract surgery. The results of this study would suggest the need for careful consideration when discussing visual outcomes with patients and the methods by which that information is determined. Profile of central corneal thickness in diabetics with and without dry eye in a study population was a study to determine the impact of diabetes in patients with and without dry eyes on central corneal thickness measurements. Because the evaluation of central corneal thickness is essential in a wide range of ocular disorders, such as glaucoma and keratoconus, this data of a specific population may be helpful in managing conditions where central corneal thickness plays a role. And while the results suggest that individuals with dry eye and diabetes have a mean central corneal thickness lower than in diabetics without dry eye, further study needs to be done to investigate the corneal endothelium and tear film in diabetic patients with and without dry eye. And finally, with an unprecedented array of vision correction on the market today, more optometrists are counseling patients on their options while in the examining room and prescribing vision corrections in the same manner that they might prescribe pharmaceuticals. Optometry's practice strategy this month outlines doctor-driven dispensing and begins a review of new developments in eyeglasses, contact lenses, refractive surgery, low vision devices, and corneal shaping. Your journal can also be accessed by logging on to www.optometryjaoa.com. I hope you've enjoyed this brief summary of August Optometry.